Hello and welcome to the New School OBGYN podcast, a podcast in women's health, but for everyone. Our goal is to promote good and reliable knowledge because the source of your information matters. My name is Eric Schmidt. I'm a board-certified OBGYN, and today I have with me Taryn Miyaoka. Welcome back, Taryn.
Thanks for having me.
I'm hoping that my audio with Taryn this time is better. We had another hiccup, but I think I got it. Today we're going to be talking about nausea in pregnancy. Please consider downloading and following along. We're in all the major podcast hosts, and check us out on YouTube for the video podcast, as I hope to get that up in the near future. Again, Taryn is one of our physician associates, and she's from the Pacific Northwest also, and also a graduate of University of Washington, and did her PA school in Wake Forest. Okay. And so why are we talking about nausea and vomiting in pregnancy, or as it may be called, is morning sickness? Why is it significant? Well, it can impact the quality of life, and sometimes significantly, and whether this is work, ability to do things like exercise, relationships, social interactions. It's one of the leading causes of hospitalization. So hopefully we can discuss some safe interventions and to minimize, and so we're not minimizing the morning sickness. So why do I have Taryn with me today? Well, on this podcast, she's announcing to everyone that she's pregnant.
Yeah, I am.
Congratulations.
Oh, thanks. Guess who my OB is? This guy.
I'm making her come here. No, I'm just kidding. So hopefully we can get some both good professional and personal experience with this. And been battling that.
Yeah.
So go ahead, Taryn, with some of the information about nausea in pregnancy.
So just some general information not pertaining to me, but nausea affects about 50 to 80% of pregnant people. The emesis, or what we call vomiting, is about 50%. Usually happens or starts happening about before 9 weeks, and it's hard to say whether or not you'll have a recurrence if you get pregnant again. That can be kind of unpredictable. About 15 to 81% of people can experience it again. Do male or female fetuses cause more nausea and vomiting? I'll be interested about your input. I know that I've heard when people are trying to decide on gender, just using those kind of clues, that I've heard females cause more nausea and vomiting.
That is correct.
Okay. But whether or not that's true,
I don't think it's a strong association, but
no.
Statistically, I think they potentially see more with the female sex of the baby.
I guess for me, that's not true, because based on my testing, it was male fetus, and I've had
another announcement on this channel.
Oh, yeah, wow. I guess so. Well, you guys are getting all the tidbits. And then nausea and vomiting can lead to what we call hyperemesis gravidarum. Gravidarum. Which is basically just the extreme end of the spectrum in terms of nausea and vomiting. This can occur in up to 3% of pregnancies. Kind of the trademarks of this are 5% of weight loss and some evidence of abnormalities such as ketonuria, so ketones in your urine, electrolyte abnormalities, and other organ system effects. And we can talk about how you can tell if you're dehydrated if you're having nausea and vomiting and can't keep anything down.
I mean, one of the best ways is to look at your urine or your pee, and the color of it, because if it is a clear to lightly tinged yellow, you're usually well hydrated. If it is dark, almost orange, and you're having significant nausea and vomiting, you need to let your provider know, because you're starting to become dehydrated, and that can come with other symptoms too. So when we look at this, we say, well, why does this happen? Or what causes this? And it's actually kind of unknown. We have kind of accepted that it's the pregnancy hormones, specifically HCG, or the human chorionic gonadotropin, because this elevates early in pregnancy, and that's usually in those 6 to 8 weeks, 9 weeks, 10 weeks, it started to elevate, and that it plateaus a little bit and then starts to go down a little bit. And so that's correlates with when the most severe nausea and vomiting in pregnancy is in that first, kind of that mid to latter first trimester of the pregnancy. But, there's no, there's people that have no nausea and vomiting in pregnancy. And I'm sure a lot of people are jealous of that, but but their hormone levels are just as high. So it's definitely variable. There's also an increase in estrogen. We know that estrogen through birth, like higher doses of hormones, not in pregnancy that we use, but birth control pills, things like that. One of the side effects of that can be nausea. So potentially a couple different complicating factors. And we see that there's an increase in HCG hormone with more placental tissue, and so specifically with twins or multi-gestation pregnancies, there's an increase in nausea, more severe nausea with those pregnancies. Another thought of why nausea may be prevalent is maybe an evolutionary adaptation, and this could be certain aversions, because first trimester is a very fragile, delicate time. We want to, all the organ systems of baby are growing. That's really when we harp on, a good diet, really things to avoid or situations to avoid. And so maybe there's an evolutionary component for all these aversions or these nausea. That's not well proven or studied. It's kind of a theory. And so, and then even more of a theory is maybe there's a psychological predisposition. And this is very varied on opinion, and evidence is not great, but there's a thought that specific personality traits or psychological diagnoses may predispose to increased nausea and vomiting in pregnancy. And that is questionable at best. So, moving on. One often kind of a concern that I get from patients is, they're worried about their baby. They're worried about how this malnutrition, or just, they're not usually having a normal diet because, whether it's just some light nausea or some food aversion, you're not really eating normal, or what you did prior to pregnancy. That was probably for you.
Yeah, for
sure. And often there's a little bit of weight loss. And so can it be dangerous? No, it's not. The pregnancy is very small. The nutritional demand is not high in the first trimester. And so even with a very significant weight loss or hyperemesis gravidarum, where you're really malnourished, you're getting electrolyte abnormalities, we really don't see an increase in harm to baby. It can, but it can be, potentially dangerous to mom, and that's why sometimes there's hospitalization to help correct, and more interventions, which we'll talk about later, to help make mom feel better and healthier. So, and now prevention. Go ahead, Taryn, with some recommendations and also personal.
Yeah. Can it be prevented? So some evidence shows that starting a prenatal vitamin or multivitamin can maybe reduce the incidence. I didn't find that to be true. I was taking a prenatal vitamin.
Even beforehand? Yeah. Even before the pregnancy?
Which we recommend doing in general. But yeah, and then, when people are having nausea and vomiting, a lot of times they stop taking their prenatal vitamin because sometimes it can be a trigger for nausea for some. So there's always a little bit of difficulty with that there. But didn't find it helped me. Some dietary changes, less published, but pretty general recommendations I think everyone tends to make are trying to have smaller meals, potentially more frequent meals instead of 3 big meals a day, maybe 6 to 8 small meals, avoiding spicy, fatty, acidic foods, and trying to have high protein snacks. I think this is something I try to emphasize with patients because they're worried about their nutrition intake, and trying to emphasize if you're going to eat a small amount, just trying to have it a little bit more nutrient dense can be helpful. But also just doing what you can, because it's a little difficult. And non-meat protein like dairy, nuts, protein powder, and shakes can be a good way if meat's just not sitting very well.
What kind of tea are you drinking right now?
I'm drinking ginger tea.
Yeah.
It's funny because I don't really like the taste of ginger in general. Like, I find it kind of overpowering, but this one's pretty pleasant. So ginger supplements are found to sometimes help, like capsules, candies, tea, ginger ale. I think I drink it because, people say to. I don't think it really helped, but it's not bad. And then acupuncture at the P6 point at the wrist, which, do you want to show us where that is? Because I don't know.
I think it's right about here.
Yeah.
I first learned about this when I was on a boat, and they were handing out those wrist things for people who get nauseous. Because there's some, whether someone believes in acupuncture or not, a lot of times when you're experiencing this nausea, vomiting, whether it's first time or not, you're just looking for something,
right?
Some improvement, and to avoid worsening. And so when, some people are, again, if you miss prenatal vitamins or multivitamins because you just can't stomach it, don't worry about that. Like, take it when you can. And often, it's deemed morning sickness a lot because it's sometimes worse in the morning. And so you don't have to take your prenatal or these medications in the morning. Actually, maybe it's better to take it at night. And so those are some things that you can do as long as there's no serious, if you have serious allergies to any of these things, something you can do even before you contact your provider, newly pregnant. But I would let them know, even if you haven't had your first visit yet, call the office, and hopefully they can guide you for some treatments before your first visit, because a lot of times your first visit might be around 8 to 10 weeks. Like we talked about, this usually happens before.
Yeah.
So medications that we can do, I kind of have my own algorithm that I've thought up. Our ACOG, or our governing body for our profession, kind of has theirs too, which is very similar. But the nice thing about, let me go back a little bit, because some people are worried about starting medications, again, because we're wanting to reduce the number of things we take in pregnancy, but that we have to balance that against potentially the potential consequences of this nausea, vomiting turning into things like hyperemesis. And so, I don't, especially for the first few medications, I try to emphasize patients not to be too hesitant about. And those would be medications like vitamin B6 and doxalamine, or brand name Diclegis comes as a combination pill, or you can take them separately. Doxalamine is Unisom. You can get both of these over the counter. And you really can't take too much B6, but generally 25 to 50 milligrams once or twice a day would be perfect. Doxalamine will make you a little bit sleepy. Unisom is an over-the-counter treatment for insomnia, and so that could make you a little bit tired. So again, maybe good to take at night. But similar medications like Benadryl, so those antihistamines can be beneficial. And again, but will make you sleepy. But these are usually generally accepted, very safe things to take in pregnancy. So you can pick these up, or the support persons. I'm sure Parker has helped you a lot with.
He has helped me a lot.
And he's going to be very happy about his first mention on the podcast. And so now we're, if those aren't completely making it this tolerable, there's a bunch of other medications that we can do. And so there's other medications like Compazine, Reglan. You can take those about 3 times a day, and no serious adverse effects that can be associated with that we're aware of. And I'm off. And also there's a medication called Zofran or ondansetron, and that's probably the strongest medicine we have. And so there's some more recent mixed studies on whether or not there can be increased risks of some potential like cardiac defects, and these are on the order of like a couple increase in 1,000, and so it's really not terribly significant. But because of that potential risk, we're saying try to wait until after 10 weeks to do the Zofran. And more severe refractory cases of hyperemesis, there are, if those aren't working, not able to tolerate food, drink, water, then often we're starting to get close to potentially admission, especially if there's electrolyte abnormalities. And so one potential way to save admission is a little subcutaneous pump, and we've used this with some success for patients where home nursing comes and sets you up with a little subcutaneous infusion pump, so you're kind of getting a continuous infusion of medication like Reglan or Zofran to hopefully save admission. And also some of these medications, such as like the phenagrin, can be a rectal suppository, which doesn't sound great, but when we're bordering on admission to the hospital for this, it's something to try. And just for a little tidbit, like we still have a couple other interventions beyond that, such as steroids, but I think that's beyond the scope of our podcast here. So yeah, what I say for nausea, vomiting, hyperemesis in pregnancy, it's never too early to contact your provider if you're having symptoms. They can help guide you, even if you haven't had your first visit yet. And don't be afraid to start some of these early interventions like we talked about. And another thing too to keep in mind is there are other conditions which can cause nausea and vomiting, and it might not be necessarily nausea, vomiting in pregnancy. A couple things to watch out for is if all of a sudden your nausea and vomiting starts out of nowhere and it's beyond 9-10 weeks, that's a little bit unusual, and you should definitely bring that up with your provider. Or if there's severe abdominal pain. Now, with nausea and vomiting in pregnancy, you're going to have a little epigastric soreness, pain, potentially muscles are sore from dehydration or retching, but you shouldn't have severe pain. So if you're having that, let us know. Or fevers, something like an enlarged thyroid gland, which is kind of like here on the neck. If that thyroid is overactive, can definitely be some nausea associated with that. All right, I just talked a lot. Sorry. And so I want to hear a little bit about Taryn's experience, when this, with this pregnancy, first pregnancy.
Yeah.
When did it all start for you?
I would say around 6 weeks it started for me. I have heard that people who have that get motion sick or have issues with that, sometimes they're a little bit more predisposed to having nausea and vomiting in pregnancy, which I do. So I was not super surprised, I guess, when I started experiencing it, but wasn't happy about it. I think nausea is probably one of my least favorite bodily symptoms to experience. I did not experience vomiting at all. I think sometimes I would dry heave early in the morning, but I would have nothing in my stomach to give. And so that was pretty much it. But the nausea around 6 weeks is when I really started noticing it. And I wasn't established and I wasn't telling people at work that I was pregnant either. So I was kind of trying to manage it just with the vitamin B6 and doxylamine. And that wasn't super helpful. For me, my general pattern, I would notice when I would wake up in the morning, it'd be really bad, especially on the days that I would have to go to work because I'd be waking up earlier. On weekends, if I would be able to wake up later in the day, sometimes it wouldn't be as significant, but usually waking up around 6:30, and then it would sometimes kind of go away around 10. And then I also would have nausea at night too, so before I'd go to bed as well. Yeah. So definitely not just morning sickness, but it was worse in the morning for me, for sure.
Sometimes what I hear from patients and people going through this is the nausea sometimes is, vomiting seems worse, but the nausea, the unrelenting nausea or the recurring nausea can be just as bad of a component of it. And it's different for everybody. Mm-hmm. It really is. And so try not to compare yourself to others. Right. And not comparing, not thinking something's abnormal if you're not having it, or if you're just really severe. Like, don't automatically think there's something wrong with a pregnancy, because that's definitely not a correlation.
Yeah. I think, my appetite was really low because I was nauseous, but I think it was this balance of trying to eat, because I noticed if my stomach was empty for a long period of time, it would make my nausea worse. But also, you don't feel like eating when you're nauseous. So it was kind of hard to really find that balance of like trying to snack a little just to see if it would help, which sometimes it did. Other times it didn't. So I think there's a little bit of that. You just kind of have to play with it and figure it out for you. Because I did notice, like, if I did go a long time without eating because I was nauseous, it would get worse. And if I just ate a little bit of a snack, doesn't have to be big, it would make it a little bit better. So I think trying to encourage people to try that, even though I know it seems very unappetizing.
Yeah, the brat diet.
Yeah.
If you recall, learn, that bananas,
rice.
At first, I think how to spell brat, and so rice, applesauce,
toast. Yeah.
Crackers.
Yeah.
That's not part of the word, but so you're nibbling on little bland things, because that might help. Like you said, it might help sometimes, and it's get you some nutrition. But then there's there's bad cases where any food will trigger it to go cascade or snowball into a worse situation. And so when we're looking at hospitalized patients, often they're NPO, they're not eating because we don't want to trigger it to worse until we get a hold of it with the medications, and then slowly introduce things. And so it's funny, it's different for everybody. It's so don't talk to your provider. They're aware that it's different for everybody, but don't try to compare yourself too much to others. That just gets frustrating.
Yeah, the Reglan and the Zofran did work for me when I started taking them, so that's always nice to have something that does work. I think some people are still will still have nausea vomiting with those medications. Like, I would still have breakthrough, like, nausea. But it still gave me enough, I feel like, to get by. I think one of the things that's so hard with anyone that has to do anything during their day, whether it's like take care of other little ones, go to work, or just take care of the house, or just literally do anything. Like, it sucks when you have nausea or vomiting in pregnancy. And you're not, like, actually sick, so I had no excuse to not go to work. But, like, I was talking to one of my colleagues about it, and they're like, it's kind of like you have the stomach flu and you just have to pretend you're fine and try to function normally. And it really sucks.
We can definitely tell Taryn's not herself, because she's normally even now you're, still, I feel like, hindered about, and whether it's the nausea or the fatigue of early pregnancy too. Right. It's hard to be normal, to do all those daily things, and it can be hard on psychologically. I've definitely had patients where this has drove them absolutely up a tree, nuts. They're beside themselves that how this can make them feel, but it's again a thing that needs to be discussed more, and understand how this can be. And
I think just like missing I guess I'm a kind of person, I miss my normal routine. And so, like, I used to work out 4 or 5 times a week before I was pregnant. And, like, after really 6 weeks, I just have laid in bed. I can't really do anything. So I think you start to not feel like a normal person anymore, because of what you don't feel up to doing. And I think that's hard to deal with sometimes.
You got to just sometimes make it through the first trimester, whether it's nausea, the fatigue, the anxiety, concern about miscarriage, like all pretty big draining factors about the first trimester. And you're not going to necessarily be yourself. I mean, there might be rare cases where people are, but, we talked about things like exercise and that in pregnancy in one of the earlier podcasts. And yes, we want that to happen, but also if you can't, and you just need to lay there and rest and recuperate, I mean, definitely forgive yourself and take it easy on yourself, because just trying to get through the first trimester, if I ever had to go through it, would be my least favorite. I already know it. I can't have a tummy ache.
Yeah, we'll see.
I can't have a tummy ache and work. Anything else you wanted to add?
No, just, keep trucking on. You got it.
Yeah, It does get better, even though it's hard to see sometimes.
I don't know. I hit second trimester and I still have nausea this morning, so we'll see if it gets better. Time will tell.
This podcast will come out whenever Taryn announces. So
Yeah.
Announce soon. No, I'm just kidding. Well, thank you everyone for listening, and that's it for today's podcast. If you have any questions, let us know in the YouTube comments or newschoolobgyn@gmail.com. As always, content of this podcast and video are for educational purposes only. None of the content is meant for personal medical advice. Please contact your provider if you're in search of medical advice. Thank you and have a good day.
Bye.
Bye.